Hello, everyone. Welcome to the second session in this Rittenhouse Open online course series with Springer Nature. I'm your host today, Laura Duray, Marketing Director with Rittenhouse. Before we get started, I wanted to take a moment to run through some housekeeping items. Just some friendly reminders. This session is being recorded and all attendees today are going to be on mute. After the broadcast, we will make the recording available on the Rittenhouse YouTube channel. We will be having a Q&A time at the end of this presentation. You can submit questions through the GoToWebinar control panel, and there are some handouts that we would like to call to your attention to. There's a copy of the PowerPoint deck of this presentation, the title list, and an info sheet of upcoming webinars, the remaining two sessions in this series. All right, so we're glad you're joining us today. As I mentioned, this is the second session of the Going Blue series with our partner Springer Nature. Today's session will focus on Springer Nature's initiatives with artificial intelligence in clinical medicine and beyond. Joining us today are key editors with Springer Nature, Grant Weston, Executive Editor, Clinical Medicine Books, and Gregory Sutorius, Executive Editor, Clinical Medicine Books. And with that, Grant and Gregory, thank you for being here today, and I will pass the mic over to you.
Thanks very much, Laura. Hello, I'm Greg Sutorius, an executive editor for Springer Nature's Clinical Medicine book team. Today, my colleague Grant and I will be demystifying the use of artificial intelligence in clinical medicine and discuss how we publish in this area. We'll begin by running you through a brief introduction to Springer Nature's Clinical Medicine book program. We'll then provide an overview of AI in clinical medicine. Next, we will go on to explain how this is becoming so critical to the healthcare professional before discussing some of our key resources in the discipline. Finally, we'll be happy to take any questions that you may have.
Hi, I'm Grant Weston, also an executive editor for Springer Nature's Clinical Medicine Books team. Greg and I are two of the more than 60 commissioning editors in the team, and together we're responsible for the fact that Springer Nature is the leading publisher of clinical medicine books by volume across all medical specialties. Our authors and volume editors are key opinion leaders from prestigious academic health centers around the world, including Mayo Clinic, Cleveland Clinic, Mass General, the NIH in the US, but also in Europe, the LaGuardia Hospital, Pitié-Salpêtrière, Charité Hospital, University Hospital, St. Thomas's Hospital, and University College London Hospital. With Greg, we'll now take you through our publishing program in artificial intelligence in medicine. For the record, we're presenting this overview in mid-2023. We have no doubt that there will be phenomenal change within this topic over the coming years. Health informatics is the discipline at the epicenter of this new frontier in medicine, being at the intersection of technology and healthcare. It includes everything from the management of electronic health records through clinical decision support, mobile health, to artificial intelligence. Artificial intelligence, or AI from now on for brevity, is an enormous and hugely complex topic in terms of the technology itself, its application in medicine, but also the impact that it has on healthcare and as it affects individual patients and the society as a whole. AI can trace its origins back to the 1950s, in the earliest days of computer science, with medical applications dating back to the mid-1970s, a time otherwise considered the AI winter, when funding, computing power, and public attention had yet to catch up with the lofty conceptual goals of the discipline. Developing out of work into the algorithmic analysis of organic chemistry, the earliest use of these so-called expert systems in medicine were largely in the research space. For instance, identifying the potential of bacteria to be pathogenic and to analyze potential treatments for these bacterial infections. With the exponential rise in computing power over the past 50 years, the potential of these technologies has similarly grown. At the same time, we've seen the push towards personalized medicine, the model in which medical decisions, practices, interventions, and products are tailored to the individual patient based on their predicted response or risk of disease. AI is critical to supporting personalized medicine, and this is where our titles on the topic are designed to have maximum impact. But what is AI? Now, a quick disclaimer. AI is certainly artificial by definition, but researchers and informaticists tend to use a fairly broad definition of intelligence. At its simplest, AI refers to any computer-based technique that aims to achieve intelligent behavior. AI therefore represents a rather general catch-all for a number of concepts. AI, machine learning, deep learning, and artificial neural networks are strongly related, but are in fact progressively more precise concepts and form the foundational technologies for other notable processes, including big data processing and curation. Big data represents the fuel that medical AI runs on. Without access to huge patient and population data sets, these neural networks are starved of material they need to process. Natural language processing is another foundational technology critical to medical AI. The current noise around and the technology powering ChatGPT, Bard, and the other proprietary chatbot solutions has been fed by developments in this area. Medical applications currently vary widely, from patient support chatbots through to large population-based analysis of text in medical health records to discover potential trends in diagnosis or treatment. Visual processing has been a long-established area of development for medical AI and involves other computational techniques, such as fuzzy logic processing, to broaden the reach and accuracy of imaging modalities. Ultimately, the goal is to use these computational techniques to augment the output of the imaging hardware itself, providing clearer medical diagnostic and patient management solutions. Lastly, these technologies should not be viewed in isolation. Many healthcare solutions in AI take a blended approach to using the available technologies, using multiple models to tailor results to the required end goal.
Thanks, Grant. Up until now, the information has been far more general, applying to the students of health informatics. But the real excitement is the application of these technologies to specific use cases. In understanding that a suite of AI technologies is providing support to modern healthcare provision, the trainee and practicing physicians across all of our clinical areas are needing to know how these new technologies can benefit their practice and the potential pitfalls that might await them. Our aim is to demystify the technologies and provide the following benefits: improved clinical accuracy and efficiency, reflect on the insights and recommendations for those considering AI solutions, revealing the potential for advances in effective telemedicine, the rapid analysis of complex radiology imaging sets, and finally, supporting and empowering genomic and proteomic research, which is the processing of huge personal and population data sets of genetic and proteomic information. At the same time, our authors also reveal the challenges of AI in medicine. And this is ensuring clinical oversight, the privacy and safety issues of using these technologies. There's bias and viability of the source data, in other words, a garbage in and garbage out conundrum. And then there's sustainability and data ownership.
For the last 25 years, the Health Informatics series has been Springer's preeminent book series in the area. It was derived from another older series, Computers and Medicine, in which was published our first book title in medical AI back in 1988. Over the years, the focus of this series has moved away from publications solely for medical informaticists to any medical professional involved in the management of healthcare technology. This parallels the impact of healthcare developments around the world, but particularly in the US, where federal regulation over the past 15 to 20 years supercharged the expansion of healthcare technology and its wider impact on physician, surgeon, nurse, pharmacist, and patient alike. The Health Informatics series has many titles published on AI and is ably supported by several other series in this area. Cognitive Informatics in Biomedicine and Healthcare is dedicated to understanding the interface between medical technology and the user, while Health Information Technology Standards is a much more technical series looking at the interoperability of medical data between systems. Moving on to our key front list titles in the area, the next few slides reveal the range of books already published and available in AI in medicine. The three titles on this page represent what a reader would be looking for as a primer in the field: a textbook, a reference work, and a State of the Union editorial piece. Now in its fifth edition, the Shortlift, as it's known, is the principal textbook in biomedical and medical informatics. And while not dedicated to AI, the lead editor, Ted Shortlift, has long been considered the father of modern medical AI. Ted and his fellow editors and authors bring this insight into the discussion of AI within the wider topic. AI is simply a cog within this machine. Artificial Intelligence in Medicine from Lidströmer forms part of our reference work series. This volume is closer to an encyclopedic review of the topic, but one grounded in the language and techniques of clinical healthcare professionals rather than the technologists. Lastly, the RAS title is more of a piece of blue sky thinking to prepare doctors for the future of AI in their practice. These next three titles show how Springer Nature's Medicine program approaches education within AI, reviewing the cornerstones of the technology and how each of these combine to affect change within clinical medicine. The first title provides a detailed review, particularly aimed at any healthcare provider in cardiovascular medicine, to consider the implications of the vast amount of data their profession creates and how its processing using AI can improve the health of their patients. While not yet published, the book by Simon and Aliferis provides a comprehensive review of the nuts and bolts of applying machine learning concepts to various medical questions. And the last book on this slide offers an accessible introduction to deep learning in medicine, albeit with a focus on application and visualization. This is becoming critical in order that readers can have practical context to consider these often highly complex clinical topics.
With this third set of books, we reveal titles that are applying the previous AI concepts mentioned for the betterment of patient welfare in medical practice, taking the core principles and providing real-world use examples and providing a path for others to follow in the space. The first title, Artificial Intelligence in COVID-19, another from Nicholas Lidstrimmer, uniquely describes how the diagnostics for COVID-19, which range from radiology and molecular biology to immunology and biochemistry, were developed with the use of AI. This title is designed for readers to engage with broad medical backgrounds and give practical, scientific, and clinically relevant examples of medicine and mathematics. The second title, Machine Learning and Clinical Neuroscience, is a slightly unusual book coming from a conference proceedings, and it discusses the clinical applications of machine intelligence for improving patient care in clinical neuroscience. It reveals the sheer breadth of authors providing important educational and research material in the space. The next book, Clinical Neurotechnology Meets Artificial Intelligence, debates the many cutting-edge neurotechnologies in development and their potential impact on medicine. With a focus on AI and various brain-computer interfaces, chapters are authored by a diverse mix of academics with backgrounds beyond medicine, including philosophy, law, and social sciences. This allows the reader to explore the ethical spectrum of emerging AI neurotechnologies. The last title on the slide, Artificial Intelligence in Brain and Mental Health, is another important book that provides a multidisciplinary and comprehensive analysis of the philosophical, ethical, and policy implications of AI. It examines existing ethical challenges and regulatory gaps that could hamper the development and implementation of AI, which is becoming ever more important as we move into more and more complex relationships with these technologies. This final set of book titles reveal the publishing output in recent years regarding the AI processing of imaging data to assist healthcare providers. Springer's long-standing position as a preeminent radiology publisher provides us with fantastic opportunities to investigate these topics, and our authors have welcomed these developments. Artificial intelligence and machine learning in nuclear medicine and hybrid imaging reflects that medical imaging technologies have always made extensive uses of the most powerful computed solutions to visualize the patient as non-invasively as possible. AI is the newest tool within the discipline, and the first title specifically focuses on its use in nuclear medicine and hybrid imaging. The second book, Artificial Intelligence in Cardiothoracic Imaging, is another title published with a separate clinical series, which is Contemporary Medical Imaging, and shows how AI topics are fast becoming mainstream. This book provides practical multidisciplinary recommendations for the use of AI technology in clinical practice. It shows optimal workflow integration and provides some clues for future potential. The next book, Artificial Intelligence in Ophthalmology, demonstrates the great potential AI has on medicine. As a topic relying on big data, this title reveals a full exploration of how AI can be applied to ophthalmology healthcare, both in research applications and in the clinic for diagnosis. Finally, the last book on this slide, Artificial Intelligence in Oncologic Imaging, explores AI applications and its use in imaging with the aim that these technologies will help detect oncologic disease. This includes better defining tissue characterization, staging, and correlation with molecular biomarkers. Chapters span the most prevalent cancer types and focus on the diagnostic evaluation. The book explores how the application of algorithms and deep learning techniques can eventually be used in everyday practice. So we have concentrated over the last few slides on existing titles in our list and those that are publishing in the next few months. However, there's tremendous growth in the number of medical AI publications we are planning to launch over the coming years. We are seeing broader acquisitions for applied topics of AI in individual medical disciplines, as well as more in-depth specialized books dissecting AI technologies and how these can be used for the betterment of healthcare. The influence of AI in healthcare will only increase in the next years alongside a concurrent growth of applications for it. It remains critical that we continue to publish titles from authors that provide context and clarity to the use of AI. Whenever we speak with our authors, they are clear that the goals of AI technologies remain dedicated to providing better patient care. We will continue to publish books that are at the forefront of this technology, that further demystify AI and define its importance to healthcare professionals in the years to come. Thank you very much for your time and this opportunity.
All right. Thank you very much, Grant and Greg. Very interesting stuff. And we'll definitely be interested to see what's on the horizon with Springer Nature and the content that is put out over the coming years. I think, as you mentioned during your presentation, it's just going to be ever evolving. So it'll definitely be interesting to keep an eye on. We do have some questions that have come in, and as a reminder, if you have any additional questions that you want to submit, you can use your GoToWebinar control panel. So the first question you all mentioned in your presentation about ChatGPT, but is there any relevance to AI imagine creation applications such as Midjourney to medicine?
Shall I take this one, Greg?
Sure. Yes, please.
So yeah, we discussed the use of imaging processing within the field of radiology. So this is already a long established area of the use of AI within medicine. The current more general tools that are available to the general public are not really of much use to us within medicine and medical publishing at this moment in time, mostly because those services are fraught with other issues in terms of copyright and data ownership and those kinds of things. So we don't currently use those within our book publishing, but and certainly within medicine, it only tends to be used as a byproduct to other things. But as with everything in this technology, it's keeping your eyes open and seeing what happens in the future. I don't rule anything out at this point in time.
Okay, very interesting. Thank you. All right, and the next question, an interesting but short question: do you use AI editorially?
I can answer that. It's used generally only in specific tasks. For example, we utilize anti-plagiarism software and also to help subject coding of keywords. We also use it in some of our translation processes, but of course, just like everything else, there's huge potential for expanded use.
Okay, and this next question, it's a good segue question. Do you use AI to help commission any new book titles? All right, and one final question. How do you ensure that the goals of AI technologies should be dedicated to providing better patient care in your books?
I'll answer that. It's just really like any other book for as far as we see it. We have a process of peer review and internal review just to ensure that the quality is there and it's appropriate and relevant for our audience. It's something that we have to continue to evolve with, and we'll scale these processes to match the needs of our readership.
All right. Okay, thank you both very much. That's all the questions that came in. We have a couple more slides to go through, but Grant and Greg, we definitely appreciate you joining us today. And as always, thank you, Springer Nature. So I can continue on with our next slides.
Great. Thanks, everyone. So I hope that everyone enjoyed this webinar. And just so you know, we have 2 more webinars coming up before the end of the year. So we have personalized medicine on October 11th and veterinary medicine on December 6th. And yeah, we're excited about these ones too. So for personalized medicine, we'll be talking about how personalized medicine applies to medical professionals' practices and can improve patients' experiences. And then for veterinary medicine, we'll be going over how veterinarians and students can stay up to date on all the cutting edge developments. And so if you are interested in these, please be on the lookout for an email from Rittenhouse. Also, we'll be sharing a handout after this with details on each session and then registration links for the following sessions as well. Thank you.
Yeah, thank you, Madeline, definitely. All right, and just the final slide. Again, this is Laura from Rittenhouse. Just want to remind you that the title list that is available as a handout, all the titles are available in print through rittenhouse.com. And there's a special collection of the select list of active ebooks that are on the list that are available on the R2 Digital Library. And if you want to contact us to learn more about how to access those books, both in print and ebook, reach out to myself or our customer service contact information. All right, and thank you all very much. Again, thank you to our partners at Springer Nature. Special thank you to Grant and Greg for all your insight into AI and how it applies to clinical medicine in your titles. And thank you to all of our attendees, and we look forward to you joining us in the next session. Take care, everyone.